Hello, my name is Alex Herring. I'm one of the orthopaedic physiotherapists working at South Tyneside and Sunderland NHS Foundation Trust. This is a short video for patients to explain what to expect from physiotherapy when coming in for your total hip replacement. Following your total hip replacement, you will have some post-operative pain. This is normal and will settle over time. It is important for us to help you mobilise as soon as possible after your total hip replacement, as it reduces the chances of any post-operative complications such as hip stiffness, pressure sores, blood clots and chest infections. The day following your total hip replacement, the physiotherapy team will come around to your bedside. They will recap your hip precautions, which the occupational therapy video will go into in more detail. The physiotherapy team will assist you out of bed, and initially you will start walking with a Zimmer frame. Over the course of 1 to 2 days, you will be progressed onto 2 walking sticks, and if you have any stairs at home, the physiotherapy team will take you along to the stairs to have a practice. Before being discharged from hospital, we will show you your exercise regime. This is in the back of the booklet and also demonstrated at the end of this video. Following discharge, the physiotherapy outpatient team will get in touch with you either via letter or via the telephone to continue your ongoing rehab plan. There is a set of 3 exercises that you will need to do following your total hip replacement. You can also do these exercises before you come in for your surgery to increase your strength and mobility at your hip. These exercises should be completed 3 times a day, 10 repetitions of each. The first exercise is hip extension. Holding onto a stable surface, you should be taking your operated hip out behind, hold for a few seconds and then back to midline. While doing this exercise, keep your back nice and straight and up tall. The second exercise is hip flexion. Holding onto a stable surface, take your operated hip out in front of you, lifting your knee. Your knee should become no higher than your hip. Hold for a couple of seconds and then back down. So that's your operated hip out in front of you. Hold for a few seconds and then relax back down. The final exercise is hip abduction. So taking your operated hip out to the side, hold for a few seconds and back to midline. Operated hip out to the side, hold for a couple of seconds and then back to midline.
My name's Megan Hodgson and I'm an occupational therapist at South Tyneside and Sunderland NHS Foundation Trust. As an occupational therapist, we enable people to carry out daily activities independently and safely. As occupational therapists, we may provide you with equipment, advice, teach you new ways or techniques to complete daily activities independently and safely. Preparing your home before coming into hospital will make things easier once you are discharged. Occupational therapy can help you resume your activities as quickly as possible. Following your hip surgery, there are certain movements that you must avoid to protect your hip from dislocating. These must be followed for 6 to 8 weeks and we call these hip precautions. Hip precautions include not bending the hip beyond 90 degrees, no twisting at the hip, and not bringing the affected leg across midline either at the top or bottom of the legs. Hip precautions will be further explained to you as an inpatient on the ward. An occupational therapist may contact you prior to your surgery to discuss any potential equipment that may help you follow hip precautions, and these can be delivered prior to your surgery. A few useful tips to help you prepare the home for after your surgery are making sure furniture is moved so there is a clear pathway throughout the home, making sure any trip hazards are removed such as rugs, making sure you have easy to prepare meals in the fridge and freezer, and making sure that anything in the bathroom and kitchen are moved to waist height to avoid bending and stretching. So following your hip surgery, the most appropriate chair to sit on is an armchair, as this allows you to lower yourself down slowly. It also means at an appropriate height you can follow the hip precautions if that your hips are higher than your knees. So again, with the bed transfers, we need the bed to be at the appropriate height to follow hip precautions. While sitting on the bed, your hip needs to be higher than your knee. With your arm strength, you need to pull yourself to the centre of the bed and avoid a shuffle movement. You're then turning, keeping your legs as close together as possible. If you can't achieve that, then walk your feet out slowly. Lying down, And then again, sitting yourself back up, keeping your legs as close together as possible, and sitting back onto the edge of the bed. Again, to follow hip precautions, you need to avoid bending forward, and we can achieve this by using a long-handled shoe horn to put on your shoes, like so. So this is a pick-up stick, and this can be used to help with putting clothes on your lower limbs. It can also help with picking up objects to avoid bending down. This is a long-handled sponge, and this can help with washing your lower half to avoid bending down. So following your surgery, it's likely that you'll be given some form of walking aid, such as sticks or a wheeled Zimmer frame, and this means that you haven't got a hand free to be able to transport items. So this is a trolley, which we can give to you on the ward. It means that you can transport meals or drinks. It's also height adjustable, so we can adjust it to you. But also we need to make sure that your home is level to be able to push this over it. So this is a raised toilet seat and a toilet surround frame in one, and it goes over the top of your toilet, and it allows you to follow the hip precautions again by lowering yourself slowly down onto it. It's height adjustable so that your hips can be above your knees when sitting, and it has the arms to support for you to stand up. And finally, if you feel like you need any extra support when returning home, you may highlight this to your occupational therapist or at your pre-op assessment.